If you've ever felt caught between conventional or modern medicine and holistic care, you've probably sensed that they operate very differently, but it's not always clear how or why. In this video, we're going to unpack the core assumptions behind conventional medicine and holistic medicine so that you can understand what each one prioritizes and where they diverge. I'm Dr. Kenny, an IFM certified functional medicine practitioner, and part of my work is about helping people think clearly about the systems that are shaping their health decisions. And if you appreciate thoughtful explorations like this one, tapping the like button helps me know that you'd like me to create more. Let's start by defining what the conventional medical model actually aims to do, and then we'll contrast that with the holistic approach. One of the biggest misunderstandings I see around this conversation is that people feel that they have to pick a side, almost like there's two camps and you have to pick which one you believe in exclusively. And yes, it's important to have values and know what you stand for. But even I find this black and white thinking often leaves a lot of conversations off the table for collaborative and integrative care. One of the ways that I like to frame this conversation is to remember that we're not looking at different patients. Both the conventional and the holistic systems are looking at the same person with the same symptoms and even the same lab work. But one of the fundamental differences is that they're asking different questions. And that difference changes everything about how these health problems are approached. And how this plays out in practice that I see often is that someone comes in with fatigue or gut issues or hormonal complaints, and they've already been through the conventional testing model and everything looks normal. From the perspective of the modern medical model, that may be true. No previously defined disease state has been identified. From a systems-based perspective, that's where the new line of questioning often begins. And to better understand why there's such a difference in the line of questioning, let's go a bit back in time and take a look at how the modern medical model was formed in the first place. A large part of the conventional medical model was shaped during the explosion of discoveries around infectious disease and microbes. Once scientists realized that specific bacteria or viruses caused specific disease states, conventional medicine made tremendous progress and advances by isolating those single causes, the organisms like bacteria or viruses, and developing targeted treatments from them. The age of antibiotics, vaccinations, surgical procedures, and emergency medicine, these advances saved millions, even billions of lives. And to date, they remain some of the greatest achievements in healthcare history. But that profound level of discovery and success dramatically shaped the systems of healing and healthcare. When a disease has a clear cause, a clear diagnosis, and a clear treatment according to this model, it works brilliantly. In a nutshell, you identify the pathogen, you treat it, and hopefully there's healing and resolution on the other side. The challenge is that this reductionist model is built to solve acute problems. Chronic conditions, on the other hand, behave very differently. From chronic fatigue and metabolic function, hormone imbalances, digestive and gut health issues, these conditions often don't come from a single pathogen or a single enzyme malfunction, for instance, which is what most of our traditional over-the-counter and prescription medications are designed to tackle. When we dive in and look at the physiology underneath chronic conditions more closely, they tend to emerge from multiple systems interacting over time. And this is where the difference between a reductionist model and systems-based root cause thinking is pivotal. It's not that one is necessarily better than the other, because we technically need both. In my mind, broken medicine happens when we stop allowing seats at the table for different ways of thinking and understanding and conceptualizing health and disease. And by the way, if you want to see some of the research from the models and the physiology that we're talking about in this video, I've linked to a short free research summary in the description and the pinned comment below. I always include a few key research studies in these conversations so that you can browse the information yourself. For example, I've linked to a study that compares an integrative functional model to the conventional model, and it shows measurable improvements in patient-reported outcomes compared to the standard of care model. So let's shift to the chronic disease problem. The challenge today is that many health problems, including the top causes of death in our societies, are chronic conditions. And chronic symptoms tend to behave quite differently than infectious diseases or injuries, for instance. Instead of one clear cause, they often develop slowly over years or even decades. And multiple systems can drift away from optimal function all at the same time. For example, someone might start to develop mild insulin resistance. Stress chemistry and physiology may start shifting and affecting hormone function. Sleep becomes less restorative, and inflammation may quietly begin to rise in the background. The point is that none of these changes necessarily results in a disease or a diagnosis on their own, especially right away. So from the perspective of conventional lab testing, everything may still appear within normal range, but the person doesn't feel normal. And in practice, this is the situation I see quite often. People come in experiencing a slew of symptoms, and they're told that their labs are normal, yet they're dealing with profound fatigue or digestive issues or hormone complaints that slip through the cracks, and the list goes on. What's interesting is that many of these symptoms are signals of physiological damage that have somewhere gone off the scale of optimal function to dysfunction. And when we start to look at it as a spectrum, that's what the functional and root cause approach honors. So the question in the background becomes, are we only looking for stark disease states? Or should we also pay attention to early shifts in how the body is functioning? This difference in focus is one of the reasons why the different lines of questioning come up in the conventional space versus the holistic space. And this is where the way that we study biology comes into the picture. I'm going to introduce two main ways we can think about biology. One approach is called reductionism. And this is the method that has powered a huge amount of modern scientific discovery. In a nutshell, researchers are looking for that one thing, the one variable, the one pathway, the one microbe, the one gene, and they study it very, very carefully. And this approach has helped us across numerous fields. It's helped discover specific receptors or enzymes and the medications that target them. And it's incredibly valuable. But the human body, frankly, doesn't operate in one pathway at a time. It functions as a deeply unique, interconnected network. Your hormones influence metabolism, your metabolism affects inflammation, stress chemistry changes your immune functioning, and the gut microbiome communicates with the brain and manifests on the skin. What's interesting is how these systems are constantly interacting with one another. And when we bring this to the chronic symptoms conversation, they rarely trace back to a single switch that you can turn on or off. And so this has brought about the systems way of thinking versus reductionism. Instead of asking the question, what disease is this, or what diagnosis do I have? The question becomes, what pattern of dysfunction may be tying together these processes between systems? And that opens the door to a new type of investigation. Another way I like to explain this difference is through an analogy. Conventional medicine operates a bit like a team of firefighters. If there's an emergency, a heart attack, an infection, an injury, the goal is to identify the threat as quickly as possible and put it out. That's exactly the type of care you want in an acute situation. Root cause and functional medicine tends to behave differently. Root cause medicine tends to function a bit more like a detective. Instead of asking only how to stop the fire, the detective will often ask, how did this fire begin in the first place? Was there faulty wiring? Did the system slowly deteriorate over time? Were there earlier signs that something in the structure or the function wasn't working the way it should have earlier on? Again, both roles are valuable, but both are asking different questions about the same event. And that difference in questioning determines whether or not we're just focused on putting the fire out or understanding what brought about the fire in the first place. So when people hear the buzz phrase root cause medicine, what does that actually mean in practice and in this systems versus reductionist way of thinking? It doesn't mean ignoring disease situations, and it doesn't mean rejecting conventional medicine. Those tools are incredibly important and powerful. What it really means is expanding your exploration of physiology way earlier in your timeline, which represents another major shift between conventional and holistic approaches, is the focus on taking a proactive rather than a reactive approach. Instead of waiting till one or many of your systems cross a disease threshold, the goal is to ask what other patterns might be emerging underneath the surface. For example, chronic inflammatory signaling coming from the gut, for instance, may be going on long before an inflammatory disease process manifests. And insulin or blood sugar balance issues are often drifting for years or even decades before prediabetes or diabetes manifest. And the clue that many of us miss in this reductionist model is that these shifts rarely happen in isolation. This difference in questioning and perspective becomes a lot more relatable when we start to talk about real live people. Common patterns that I see in practice include things like chronic fatigue or fibromyalgia, or chronic gut health issues that don't seem to go away, as well as difficulty losing weight or struggling with hormones or fertility concerns. What's interesting is when we turn our focus to the physiology and to the cells and the chemistry, small patterns between systems often emerge. For example, the way your cells and digestion are breaking down fats, carbs, and proteins for energy or for rebuilding. Metabolic and mitochondrial markers may be drifting offline. Hormone issues may be coming up where we have a high amount of stress chemistry or a low amount of stress chemistry, which surprises some people. That doesn't allow the immune integrity to function as predictably across the rest of the body systems. Or gut and microbiome patterns can be throwing roadblocks in your body's ability to even break down and absorb nutrients, which are repairing and restorative. The key here is that none of these findings on their own represent an actual disease pattern, but together they start to tell a story about how these systems are connected and communicating with one another, and where the stressors, the stress chemistry, might be accumulating over time. Another way that these two systems differ is how we use lab data. Conventional lab testing is designed around stark disease states to ideally identify them and then intervene. For example, blood sugar markers like HbA1c come up in the diagnosis of diabetes. And thyroid markers are used to determine whether or not you have hypo or hyperthyroidism. Those tests are extremely valuable because they do share when an organ or a single system crosses a particular disease threshold. But again, your physiology and your function is usually shifting for a long time before those thresholds are reached. In the functional space, we look at much more detailed markers, and they help us to identify patterns that conventional testing isn't designed to reveal. For example, organic acids testing can give us insight into your detoxification potential, as well as your energy and metabolic functioning at the cellular level. And advanced hormone testing doesn't just look at the presence of your estrogen or your testosterone levels in the blood, but rather how your body is using them and how your tissues are being exposed to them and detoxifying those hormones as well. And an exploration of gut health is central to the functional medicine perspective because of the many ways gut health is connected to other systems of the body, from the skin to the immune system to the hormones and even the brain and mental health. When we start to put all of these different signals and systems together, that can help to reveal patterns of dysfunction way earlier on in your unique health story. And to be clear, this isn't a replacement of conventional medicine per se, but it's an expanded lens to understand your physiology and ideally intervene before the conventional interventions become more necessary. And to sum it all up, you could think of it this way. Conventional medicine is incredibly powerful at managing acute conditions and clearly defined disease states, while systems-based medicine becomes particularly useful when someone is dealing with chronic, complex, multi-system conditions that don't fit neatly into a diagnostic box. In a perfect world, these perspectives and these tools don't need to compete with each other. In fact, they complement one another. When the patient sits at the center and these two models or perspectives are used to bring different investigative tools to the table. When we start to approach health and healing this way with an open mind, the question stops becoming this lower vibration of what system is right or wrong, and more about which lens can we use to make sense of this patient's pain in front of us. So know that these different medical models are looking at the same patient, but often with different tools, a different language of explanation, but they're asking fundamentally different questions as well. And I had a moment during my acupuncture training where I truly grasped this difference in a big way. My background before acupuncture school was incredibly technical, very math science oriented, a lot of anatomy and physiology and biochemistry, very much the language of modern biomedical science. And then I began learning concepts in Chinese medical theory, all the way from yin-yang theory to the organ and channel theory, and it almost felt like a completely different world. But about a year into the program, when I first started clinical, something really clicked for me here. Though I had my modern training, I also had this deeply rich system that is Chinese medicine to explore the world of systems-based diagnosis. And I realized that both of these systems are looking at the same person, the same symptoms, the same lived experiences, but using a different diagnostic language and a treatment framework to address the same person right in front of me. And so the conversation since then has never been about choosing sides or which is better or worse, but rather understanding the difference and the nuance between those different types of questions that each system is asking. And one of the principles that I lean on so much that ties this whole conversation is that if you're stuck in your health journey and you've asked all the conventional questions, that perhaps now it's time to ask different questions. To arrive at different answers, you must ask different questions. If you enjoyed this video, check out this next one here, which YouTube thinks you're going to like best after this discussion on root cause and systems-based thinking versus the conventional model. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.